Hi, how's it going, University of Florida College of Dentistry Administration?
Hello, senior dental student. You look tired.
I just got finished cleaning the junior-senior lab. Eric has been riding my ass for weeks.
Righto. Are you one of those class of 2011 gunners?
What?
You know, the class of 2011? The ones that had a 100% pass rate on NBDE Part 1. The ones that had a 100% pass rate on NBDE Part 2. The most academically superior class to ever set foot in the halls of the college.
Yes, I am in that class.
Well, congratulations. Because your class has done so well, we are creating a fictitious class entitled Clinical Exam 2, or Mock Boards. You will not be able to take your Florida licensure exam if you do not pass this course. Do not try to fight it. We know what is best for you. 4 years of dental school has not prepared you to take boards 3 months early.
But
this is not up for discussion. Now wear this hat.
what hat?
This embroidered Klingon Commando hat. We ordered them specially from the Starship Enterprise.
Did my tuition pay for that?
Yes. We have been waiting until right before your graduation to transition to a new clinical charting software. It is called Action.
Oh, joy. But how will we track our requirements? Are you sure the university's security settings won't slow the system down to an unbearable crawl? Why not use a real dental charting software that is used in private practices and with tech support in the United States? Like Dentrix. How will we be trained?
You will train each other, and then you will train us.
Who is going to input the information from all of our current patients?
You are. We have taken you out of clinic for 3 days to do this work. It is part of your dental receptionist training. And if you don't, you will all get variances. Dance, monkey, dance.
Speaking of dancing, did you come to bicuspid ball?
No, I do not have time for that childish nonsense. I am busy every weekend making up new requirements to make it harder for you to graduate. Listen to this, now you will need to earn 6 continuing education credits per year.
Isn't continuing education designed for dentists who are done with education?
Do not try to fight it. We know what is best for you. How is your treatment planning board case going?
Not so good.
Why not?
Well, first of all, my patient is deaf. I had to scream the mid-history for him, and it took me 5 appointments.
I'm impressed at your communication skills. I'm sure the Harold Center prepared you well for that situation.
He told me that he drinks 4 8-ounce cups of sweet tea a day. And he sips it, he doesn't gulp it. He once smoked half a cigarette in 7th grade. He eats 1 refined sugar snack as a treat in the morning, and 2 unrefined sugar snacks in the afternoon. He then told me he felt unsafe at home. I don't think this is a very relevant or accurate medical risk assessment.
Well, that seems like a very relevant and accurate medical risk assessment. What can you conclude from this?
That he is thirsty, probably has caries, was slightly rebellious in middle school, is obviously diabetic, and possibly gets beaten by his wife.
Excellent.
At the 6th appointment, I realized the full mouth series was never taken. I went to radiology, but there were so many damn juniors trying to get Comp 2 that I had to wait for a room all afternoon. The patient couldn't hear me when I told him to breathe through his nose, so he gagged and puked on my scrubs. 3 gallons of topical anesthetic spray later, the patient was both seizing and gagging. Then, I cleaned my room and didn't anticipate no retakes. But the tube head drifted and cone cut every shot.
It sounds like the juniors are working hard to complete their requirements.
On the 7th day, the patient no-showed, and I rested.
There's no time to rest. If you have time to rest, then you aren't working hard enough.
At the 8th appointment, I took impressions, but there wasn't enough microstone to pour my cast. It looked like it was all in the sink.
Wonderful. So you are getting diagnostic casts on all your patients. How comprehensive.
My patients also can't afford any treatment that I recommend.
Great. You are offering multiple treatment options. How ethical. You should consider referrals more often.
But the grad students keep stealing all my endos. And God forbid the patients need crown lengthening. That's either a 6-year commitment or an extraction.
Wonderful. It's nice to see that you are learning that specialists know more than you.
None of my crowns ever fit. I also get little pictures of flamethrowers and knives when my cases come back from the lab. I think Pride has me on their hit list.
How sweet. They are reaching out for your affection, and you are giving them plenty of work.
If only Eric would throw me a bone. That bearded QA monster has prevented my case from going to the lab 12 times. And I cannot slip anything past Sal. I even found a stinking post-it note on my new haircut. The two of them are just a vicious tag team of evil and misery.
Splendid. Their hard work and dedication to accuracy ensure that our castings fit like tight jeans on a hot woman.
More like a magnum rubber on a 12-year-old. And this is all because I didn't select the box marked Pros on my work authorization form. I mean, come on, did he think I was sending my extraction to the lab?
Well, before I go, I must remind you that you haven't completed your bloodborne pathogen training. You haven't turned in your confidentiality statement. You still need to do your privacy training. Your biomedical waste certificates are missing. And there are 3 other modules being made up as we speak, and you will need to do those before tomorrow or else you won't be allowed in clinic. Have I upset you? I know what will make you feel better. Money. I like money. Would you like to give some of your money to the school that gave you so much wisdom and experience?
But I am $250,000 in debt. And I may not have a license to work until January. I need what money I have left to survive.
Oh, don't worry. Tom Kolb can give you some more loans. That way you can get more money to give away.
Money. I'll tell you where you can put your money.